Good afternoon, sir. Hello. Hello.
You are able to hear me? Good afternoon.
Good afternoon, sir. Good afternoon, sir. Namaskar.
Namaskar. You are able to hear me?
Yes, sir. Your voice is clear.
And my picture, how it is set? Or should I move the?
I received your PPT. I will operate from here.
That is right. But picture, ठीक है? Picture.
Yeah, that is also fine, sir. That is also fine.
Okay.
Exactly.
Okay.
Hello.
Good afternoon, Basanji.
Good afternoon, sir. How are you, sir?
I'm good.
Thank you.
Yeah.
Very good. You are today looking very smart.
Yeah, good.
And I really appreciate and thank you so much for your kind gesture
Yeah,
for
sure.
following this topic. Generally, it is invisible, crowded in the
Good.
crowd, but you are able to follow it up. That is so much, so nice of you. Thank you, sir.
Sure. Good. We have Mr. Ranjan listening, so he is also committed.
Oh,
Yeah.
very good.
Once again invite Basant sir in my platform, na?
Yeah, very good.
Second time.
Very good.
Acha, yes.
Yes.
Actually,
हर महीने एक करेंगे next 3 months में.
sir, actually, Basant sir is a pioneer for nutrition, na? So I invite him second time.
Very good.
Yeah, so you are most welcome. You can invite me second, third, fourth, fifth, seventh time, no problem.
Yeah. Santosh sir till now joined.
Sure.
I'm waiting
How
for
many how many confirmations you have received?
200, sir.
Okay.
200 confirmation come, and also some person join directly, not
Okay.
register.
Yeah.
So maybe expectation is 300, maybe possible.
Okay. Very good. Anyone from the ministry or Niti Aayog?
No, sir. Any confirmation come from that side? No. I have.
Here, Mr. Basant, have you seen this book before?
No, I have not seen.
Yeah. This is a very important volume that is coming just recently published. So I managed to get a copy from US.
Oh,
It's a
very good.
very important thing about various dimensions of climate and health. Yeah.
Okay, very good. That is regarding climate.
Yes, climate change and health of the planet. Yeah.
Okay, very good. I think with Joe Biden coming, that agenda will be number one in the world.
Yes, it is. Here there is one chapter on food and nutrition on a rapidly changing planet.
Okay, who has written that?
It's one Mr. Myers.
Who is?
I'll tell you, Mr. Myers. Samuel Myers is the name.
Okay, I don't know actually. Only.
Yeah. He is one of the authors, editors of the book, actually, one of the main editors as well. He's a very well-known man.
Very good.
Yeah.
Oh, why don't you think that we can bring out a book in India?
We should try.
Yeah. So,
Yeah.
but one publisher has to support it first.
I mean, you have a good manuscript, I'm sure they will.
Yes.
Good, another 3 minutes.
ডক্টর সরকার আপনি কি বাঙালি?
হ্যাঁ স্যার।
আপনার বাসা কোথায়?
আমার বাড়ি সাউথ দিনাজপুর, অ্যাকচুয়ালি বালুরঘাটে। আমি
আচ্ছা
আমার জব সূত্রে থাকি হচ্ছে পূর্ব মেদিনীপুর,
আচ্ছা, মুর্শিদাবাদ ডিস্ট্রিক্ট নাকি?
না, দক্ষিণ দিনাজপুর ডিস্ট্রিক্ট অ্যাকচুয়ালি আমার বাড়ি। আর
আচ্ছা।
আমি থাকি হচ্ছে পূর্ব মেদিনীপুর ডিস্ট্রিক্টে, দীঘার কাছে।
এই যে দক্ষিণ দিনাজপুর ঝিল্লি বর্ডারটা ওখানে না?
ইয়েস স্যার, হিলি বর্ডার ইজ নিয়ার অনলি।
হ্যাঁ, আমি ওখানে বহুতবার গিয়েছি।
আচ্ছা তাহলে তো আপনার পরিচিত সবটাই।
হ্যাঁ, এই টাগোর সোসাইটি রুরাল ডেভেলপমেন্ট একটা এনজিও ছিল, ওখানে কাজ করে। আমি বহুতবার গিয়েছি।
আচ্ছা আপনি দিল্লি থেকে স্যার?
হ্যাঁ, এখনই তো দিল্লিতে।
আচ্ছা, মানে বেঙ্গলে কি বাড়ি আপনার?
না, আমি উড়িষ্যা থেকে, বাট আমি বাংলাদেশে 5 বছর ছিল, কলকাতাতে ছিল, এই জন্য বাঙালিটা শিখেছি। একটু বলতে পারে, অত পারফেক্ট নয়।
আচ্ছা ঠিক আছে স্যার, আমি দেখে নিচ্ছি প্রিন্সিপাল সাহেব জয়েন করবেন উইদিন 2-3 মিনিট।
ঠিক আছে।
Sir, 5 minutes, wait for 5 minutes for Santosh sir is not joining till now. Okay. Ratan Sarkar sir, principal had joined.
Yeah, he has actually he has joined. You see in the list of participants, I think
106 participants already joined.
Dr. Amit Kumar they have joined, sir. I can see his name there.
Santosh
Can you
Kumar.
Amit Kumar there?
Santosh sir is not joining till now. So I am waiting for 5 minutes. We can start on 5 minutes after 5 minutes.
Okay, sir. Yes, I can see that sir has joined now. Dr. Amit there.
Okay. Santosh sir, till now, good afternoon, sir. Good afternoon, sir.
Very good afternoon, sir.
Namaskar. So, sir, may I start?
Certainly.
Okay. So, a very good afternoon to everybody for today's webinar. On behalf of NIDM, I welcome to all participants who have joined today. I also welcome to our Executive Director Manoj Kumar Bindal, Major General Manoj Kumar Bindal, sir. Our Project Director Professor Santosh Kumar, our Project Head Dr. Kumar Raka, and Dr. Balu. I also welcome to Principal of PK College of Kotai, Sri Amit Kumar De, Sir Ji. My colleagues, Dr. Ratan Sarkar Sir Ji. On the behalf of NIDM, this program, this webinar have been organized, jointly organized by NIDM in the relevant subject of child nutrition, health and resilience. In a recent pandemic situation, this topic have more relevance for resilience of the children and women during COVID situations. We all know about that India, about 200 million people infected with COVID-19. So we know that resilience of individual and community is the key resource in fighting a pandemic. Nutritional status is the key indicator of resilience. Inadequate nutrition leads to depressed immune system. In present COVID situation, COVID-19 poses a set of challenges with impacted food system, agriculture, economy, public health systems. So it is necessary that we build resilience through the right nutrition and care, especially among those that are vulnerable with limited access to the basic services. According to Global Nutrition Report, report indicated that India will not achieve the 2015 global nutrition targets. One reason being the high level of nutrition inequity within the country. So present situation, this COVID situation, it is important. We all know that India is disaster prone country, and in five major disasters, about 70,000 children lost their lives, and also 2015 to 2016 drought, 330 million people, including 37 million children under age 5. So in current situations, in pandemic situations, recently the rapid increase in the number of pandemic cases in India, especially and all over the country. So in the view of the current situation, it is important to highlight the nutrition issues and the health related issue for resilience of the children and the women during COVID-19 situation. The main objective of this training, according to Sendai framework, according to international commitment, health is the key element of Sendai framework, and in Sendai framework also emphasis on the healthcare provision at all level, from local level to top level. So due to the NIDM initiatives, such type of program we organize in collaboration with PK College is more relevant for the children and women of the country. The main objective of this program is to enhancing the link between resilience and nutrition, to describe the common ground between the approach designed to improve nutrition that aim to strengthen resilience, to highlight growing attention to resilience present an opportunity to engage in more effective nutrition programming. So now this session hand over to Ratan Sarkar for welcome to chief guest and also speakers. So hand over to Dr. Ratan Sarkar.
Okay, thank you very much, sir. So, warm greetings and good afternoon to all, and one and all present here. I'm Dr. Ratan Sarkar, Assistant Professor of Education, Department of Teachers Training, Kumar College, Kontai, and it's my privilege and pleasure to welcome you all to participate in the webinar on child nutrition, health, and resilience, which is going to be organized by the Child-Centric Disaster Risk Reduction Center of National Institute of Disaster Management, NIDM in short, under the Ministry of Home Affairs, Government of India, in association with Pravat Kumar College, Kontai, on 7th of December this afternoon. We are indeed honored and delighted to have you all with us to participate and share your experience in the webinar on a very interesting and significant topic. Thank you for joining us from different parts of the country. Your keen interest and enthusiasm are the sources of inspiration and motivation for us to carry out such academic works in good faith. Before I request Dr. Amit Kumar De, Honorable Principal, Pravat Kumar College, Kontai, to deliver the welcome address, I would like to take the honor and privilege to introduce him to the audience. So here it is. Dr. Amit Kumar De is presently serving the Prabhat Kumar College Kontai as principal and secretary. He's a brilliant faculty, an excellent academic leader, an admirable and scholarly and skilled administrator. He is highly committed to ensure the academic and administrative excellence of the college, faculties, non-teaching staff, as well as of the students' fraternity. With a great moral hand, positive outlook, scholarly mind, and excellent administrative knowledge. Besides administrative works, he also enjoys teaching at UG, PG, and doctor level. He started his academic career as UGC Junior Research Fellow at the University of Kolkata in 1993. And soon after that, he joined the Prabhat Kumar College Kontai in 1997. During his service at the college, and before that, he served Mahishadal Raj College and Vivekananda Mission Mahavidyalaya as part-time faculty. He also has served the Department of Commerce, University, West Bengal, as guest faculty. He's a life member of Indian Accounting Association, Indian Accounting Association and Research Foundation, and Inspira Research Association. In the realm of academic administration, he has been serving as the secretary of All Bengal Principal Council of Vidyasagar University Committee. He is also the prestigious member of the governing bodies and selection committees Vidyasagar University. Journals of national and international.
म्यूट हो गया सर. हेलो, अनम्यूट.
Okay. Hello.
Okay. Now audible.
Am I audible now? Hello.
Yes.
No.
Yes. Okay. So now I request Dr. Amit Kumar, the Honorable Principal of Prabhat Kumar College Kontai, to welcome our revered dignitaries, distinguished speakers, and valued participants for the program. Sir, please.
Thank you, Dr. Ratan Sarkar, my dear colleague. I, on behalf of PK College Kontai and the organizer of the seminar on digital platform, the webinar on child nutrition, health and resilience, organized by the National Institute of Disaster Management in association with the Prabhat Kumar College Kontai today on 7th December 2020. It's a proud privilege for me to welcome all of you, especially Executive Director Major General Manoj Kumar Bindal. We have Project Director Professor Santosh Kumar. We have the Dr. Rakha, Program Officer, CCDA, NIDM. We have Sri Roy Kachrala, Senior Advisor and Consultant. We have Nutrition Man, the great Nutrition Man, Sri Basant Kaur. And we have Mr. Ranjan Kumar, Program Associate from National Institute of Disaster Management. And we have our younger brother, Dr. Ratan Sarkar. I welcome all of you in this webinar. I think during this pandemic period, all of us, all the people of this globe are suffering a lot. Out of that, the children, who are the pioneer, who are our future generation, they are suffering most. And to overcome their problematic situation, to make them adjustable with this situation, we don't know what will happen in future, but it's a great time for us, so that National Institute of Disaster Management, they have taken all sorts of pain to organize such kind of webinar, especially in this pandemic period. And I think the discussion, the resource person, the participant, all of this will make it meaningful efforts, meaningful steps towards the development of our child, especially of our future generation. Really, this pandemic period are testing our possibilities, our survival, our sustainable development. And we think with the human being, especially with the people of India, we are able to overcome all this pandemic period. We are able to succeed with our child, with our beloved student, with our beloved mother, sister, and everyone. And I think the deliberation, the discussion, everything will give a light for our future path. And with this few words, I again welcome all of you to this webinar. Thank you, sir. Over to Ratan sir.
Thank you, sir. Thank you very much for your valuable time and warm welcome address. Now, I would like to request. I can see that Professor Santosh Kumar sir, who promised us to deliver the opening remarks for the webinar, probably because of some administrative work, he is not able to join us right now. So right now, I have been suggested by Mr. Ranjan Kumar sir to place a request before Balu sir to please deliver the opening remark for our today's program. Now I request sir to please give you opening remark for the webinar.
Thank you so much, Dr. for inviting me. And it's not open since. So it's just a night to share our thoughts with you. So we all know that COVID-19 is an unprecedented situation. Children are mainly indirectly affected. For specific education, you all know that more than 8 months to their children's educational right is being affected. And apart from that, we think that how educational institution, sort of educational institutions also it also affects the educational recruitment of children. As we all had children in India for education service to the institutions, which is recent. Center where I think take to this but it was the school had the 2 to 5 children are 3 years old, like 5 time most important for the children growth because most of the happens during this 3 to 5 years old, and due to this COVID-19, if you entire life cycle is being after example, the 0 to 2 years old in the children, they are not able to immunize their children on timely due to this COVID. So, and as where we used to meet time they are completely and these education which is also affected. So if you take the nutrition after very basically time of COVID-19 situation and being a stakeholder, it's all our responsibility to all our responsibility to என்னடா அப்படி தொலைங்க?
Sir, you are not audible. Can you please look into your sir? Sir. Babu sir, your voice is breaking. Can you please
Am I
look
audible?
into your connection? Yes, you are audible. Yes, you are audible, but your voice is breaking. Can you look into your connection?
Yeah, sure. I also, yeah. The problem is here, it's heavily raining, so the network is a problem.
Oh, it seems you are from Tamil Nadu. Okay, I can understand. Okay, sir. Thank you. Please carry on.
See, and this time of disaster, what happening is children are most vulnerable group and they are being affected. By considering this child-centric disaster risk reduction center is being promoted with the support of UNICEF, of disaster management, with a certain objective of protecting children from various disasters. And our major responsibility is to look after the children in drought area and cyclone affected areas. So to protect fulfill the rights of children in the disaster, we are conducting a certain training programs in the various aspects to protect the children. So this is a small brief from the NIDM side. Now I'm handing over to Dr. Ratan Sarkar to proceed to the next program.
Hello.
Yes.
Ratan Sarkar ji. Hello.
Yes, sir. Yes, sir. It is audible.
Okay.
Sir is done with the speech, right? So,
Hello.
Yes, sir. It is audible. So I'm going to start, sir. So, okay. So, thank you very much, Dr. Balu, sir. I can understand your difficulties since you are from Tamil Nadu and it is heavily raining over there. So maybe that is the reason for your disturbance in your voice. Thank you. I can understand, and I request all the participants to clear the problem because we have no choice. Of our today's program. Actually, we have two lectures for today's webinar, and each lecture will be followed by a question and answer session. And our first speaker is a very notable personality, eminent academician and brilliant speaker, Dr. Basant Kumar sir. He is a recipient of Global Nutrition Leadership Award and fondly known as a Nutrition Man. Before I request Sri Basant Kumar sir to proceed with his valuable presentation and enriching lecture, I would like to.
Ratan sir, Santosh sir already have joined, so request to Santosh sir to say a few words for today's webinar.
Okay, so Santosh sir has joined.
Yeah. Santosh sir has joined.
Okay. Sorry, then I should. Okay. Sorry. So, okay. Thank you. So, yes. Yeah.
Now, invite to Santosh sir for say something, few words.
Sure. So, before I request Santosh sir, Professor Santosh sir, Professor and Project Director of the Child-Centric Disaster Risk Reduction Center and National Institute of Disaster Management, NIDM, Ministry of Home Affairs and Government of India. And before I request him to give the I'll say a few words about the webinar. I would like to take the privilege and honor to introduce you to the participants and delegates. Professor Santosh Kumar sir is a disaster risk reduction, policy planning and capacity development expert with 25 years of experience in different positions in the
I think I will just give a brief introduction. That's all. Just tell Santosh Kumar what we would like to do.
Okay.
Okay, so let me introduce myself first.
management from Israel and back to his international works exposure at the World Bank and Intergovernmental.
Ratan sir, I stop here and Santosh sir request to say something. Okay.
What I would, Dr. Ratan,
Yes, sir.
what I'm saying, just I will introduce myself. That is good enough. You have given my introduction, so let the participant.
Sure, sir. Sure. Sure, sir.
And so, okay, very good afternoon, and thank you very much, Dr. Ratan, for introducing me. I can see Mr. Basantakar is there, and also Ray Kacharya, I can see, and Amit Day, I can see in the panel. My heartfelt welcome to all of you, and also my gratitude for joining this particular program. I'm sorry that I got late because I was in the other meeting. I'm very much excited to understand this how nutrition and other challenges which are coming as a kind of a new challenge in the COVID-19. So children have many dimensions of vulnerabilities, and one of the vulnerabilities is the nutrition. So how this nutrition issues got intensified during the time of crisis, because we have there is a noise coming up, Ranjan.
Sir, म्यूट कर देता हूँ सर. Okay.
So anyway, so what I was telling, we have a heterogeneous family and heterogeneous group in the society. Society is not very homogeneous. Not everybody can afford the food on a daily basis without going outside the home, and many have to go outside the home to bring food and feed the family. So in this context, how nutrition, I was discussing with Ranjan the other day, and referring to one study, and Save the Children has brought a good study recently which got published. So understanding that insights in the time of COVID-19, and I will also flag that cascading disasters which are occurring, whether cyclone or the floods during the time of COVID-19. So these issues also must be discussed, and see that what kind of a framework which you suggest in this program, that would be very, very helpful for us in taking the agenda forward together with Save the Children, our social activists, our the institutions, partner institutions, and also the CCDR together. So I will not take much time because proceedings have to go, and proceedings should not be delayed. So my good luck to everyone, and once again I would request all of you to kindly deliberate on these issues also. I know that you have already planned the agenda, but in the time of COVID-19, where the migrant laborers are moving from one place to another place, people are going down in the poverty. So how they have been able to manage, and how the Jan Dhan Yojana and other things are actually helping in addressing the issues of nutrition, if they're not connected, how they can be connected in future also. So thank you very much to all of you, and I'm grateful to all the distinguished panelists who are here, and the house is open for the further deliberation. So over to you, Dr. Ratan.
Namaskar.
Thank you. Thank you very much, sir, for giving your valuable time and inspiring us with your kind words. Thank you very much. So now we'll look forward for our technical session, and The first speaker of our first technical session is Sri Basant Kumar sir. As I told you that he is broadly known as a nutrition man. He has worked in incredible national and international development organization for his outstanding contribution to the nutrition and poverty eradication endeavors. He has received several recognition, awards, and certifications. To mention few of them, I would like to read out few. First one is he was conferred with the most prestigious Global Nutrition Leadership Award in 2019.
Ratan, my heartiest congratulations to Sri Basanta Karji for the award which is going to get confirmed. So my heartiest congratulations to you.
Sure, sir. Thank you.
Thank you, sir.
Thank you. And then again, next in 2019, he received the LBTV Shah Chand Shast Clean and Healthy India Hero of the Decade Recognition Award. He has also received Government of India recognition on contribution to the Posan Abhiyan in 2018. He has received the Transform Nutrition Champion Award from India and Bangladesh in 2016. And again, in 2016, he has received Odisha Living Legend Award. He represents in several boards and governance, policy advisory and technical bodies in South Asia. So there are a lot of things to say about sir, but I will not take much of time because already we are in delay. So now I would like to request Mr. Basant Kumar sir to please deliver your valuable lecture and enlighten us with your presentation. Over to you, sir.
Just sorry to intervene. Yourself. Before you speak, only you can unmute. Please mute always yourself. Now there is no disturbance. Yeah, please. Sorry.
Okay.
Please.
Yeah, thank you. My presentation, I think you can open that. Hello. Hello.
Yes, sir.
Just open my presentation.
Okay. So wait for.
No problem. Good afternoon. Thank you so much for giving me opportunity. I'm extremely thankful and grateful to National Institute of Disaster Management, RASAB, and all the senior officials and specifically Santosh sir for giving me this opportunity. Always I say that good nutrition is good life, and good nutrition is also a PPE, personal protective equipment. And during this COVID time, this has been more important, that how nutrition can work as a potent weapon to manage and prevent infection, and specifically this pandemic infection. So important, very, very important. So let me start answering in a small way, in a little way, to what Santosh sir spoke, or at least raise some issues related to nutrition, how it can be. Then I will come to my presentation. I think there are two answers to nutrition in emergency and disaster context, because disaster and emergency compounds the vulnerability, compounds the malnutrition, compounds the poverty. So we need to follow a twin track approach. One track is mainstream nutrition in whatever program we do. Suppose in a disaster program, we have a food program, we have a livelihood program, we have a health program. Mainstream nutrition, there are many ways we can do that. The second track is,
sir, sorry for intervening. Actually, the background noise is coming from the host. So, Ranjan sir, can you please mute your audio?
Actually, already put, sir. Again, I am a host and also sharing a presentation of Basant sir, so I am not visible to see anything as a host. So first of all, I have to stop and then stop the sharing, and then I have to do. Just a minute, okay, sir.
yeah, so till such time, so one track, we should follow a twin track approach. in all our programs, all the disaster and emergency program. And another track is specifically also follow some of the nutrition programs, which is independent of disaster and emergency. For example, we might take a district where we can set up an action research program to reduce stunting, anemia, and also wasting. So this is one short answer to what Santosh sir told. So let me come to my presentation. Let me begin by saying, let food be your medicine and medicine be your food, which was told by Hippocrates hundreds years back. And now it is also true during this pandemic. It is more true when we realize that how food can be the medicine. I'll deal with that in next few slides. Next slide. So whenever we talk about malnutrition, we talk about malnutrition in many forms. Generally, malnutrition includes both undernutrition and overnutrition. So it includes both. Within undernutrition, there is stunting, wasting, anemia, low birth weight. Next slide. And also, it includes obesity and overweight. So India is a peculiar country. Next slide. India is a peculiar country where we find double burden on malnutrition. So one burden is undernutrition, the other burden is overnutrition. So in US, you might find only one burden, that is obesity and overnutrition. But India is a country where you can find double burden, which is more alarming, and we need to be very, very serious about that. Next slide. Also, there is also micronutrient deficiency. There is a deficiency on vitamins, minerals, and micronutrient deficiencies do not kill. And it might kill in rare cases, but mostly, you can go to next slide. Mostly, it can create morbidity. So it can reduce productivity. It can create infection.
सॉरी सर, it is ये PDF फाइल है, इसीलिए सर इसको पेज वाइज ही ओपन हो रहा है, ये स्लाइड वाइज ओपन नहीं हो रहा है सर. तो जो थर्ड स्लाइड चल रहा है, चाइल्ड अंडरवेट लो वेट.
रंजन जी, I sent you the slides. मैंने मेल भेजा है आपको ऑलरेडी आधा घंटे का पहले. You have the slides. Otherwise I can operate. मुझे होस्ट बनाइए. I will help.
आप अरे साहब ऑपरेट कर दीजिए.
ओके सर.
को-होस्ट बनाइए मुझे. I will do that.
ओके, मैं भेजता हूँ सर आपको.
So I spoke about double burden on malnutrition. India is a peculiar country where there is a double burden. My next slide is about why nutrition is important and why nutrition is important during.
कर दिया है आपको शेयर करने के लिए.
अच्छा. So Roy Saab is operating?
Yes.
Okay. So till he starts, let me share about how important nutrition. Good nutrition can increase productivity. Good nutrition can increase growth, and there are many studies which tells that it can increase IQ by 5 to 11%, 11 point, and annual GDP loss because of the malnutrition can be 11%. And new study tells 2 out of 3 child deaths are due to malnutrition. So it can reduce mortality, child mortality, which is the important discussion today. We can also reduce mortality by more than 50% by investing on nutrition. We can by investing on stunting or reducing stunting, we can increase productivity by 1.4%. By eliminating anemia, we can increase adult productivity by 5 to 17%. So the summary is it can increase growth, it can increase productivity, it can reduce mortality. Next slide. It can reduce mortality, and it can also prevent this pandemic infection. This is a very interesting slide. You can see where India stands today. Germany where you can find the stunting is 1%. In our case, it is around 35%. And I told you in my previous slide that if there is a stunting, it can also decrease productivity. Wasting in Australia is 0, but in India it is 17%. And generally, the people who are severely affected malnourished category, who are prone to death, the children specifically, they are wasted children. And breastfeeding, imagine, which is exclusive breastfeeding up to 6 months. In India, it is 55%, and Rwanda, it is 87%. This is a general aggregate picture. It does not mean that India is not doing well in many districts or many states. Sarguja is a district in Chhattisgarh which has 87.5% exclusive breastfeeding, which surpasses Rwanda. So there are models, there are exemplary models available in particular state, particular districts, but in aggregate, this is the picture. Anemia, which is all pervasive, you must have known. Adult anemia, pregnant women anemic, children are anemic, and here is the data about reproductive age anemia. In India, it is 53%, and in US, it is lowest in the world, it is 11%. So the summary is, it tells that, next slide, it tells that we have to do many more things and to address that and to be competitive, because if India is thinking about new India, if India is thinking to become a prosperous country which is double-digit growth, definitely nutrition is an important investment, and specifically child nutrition. This slide talks about this slide is more important during pandemic. Micronutrient malnutrition, which compounds the pandemic infection necessary for immunity and fighting infection. Vitamin A deficiency is there, vitamin D deficiency is there, zinc deficiency is there, folate deficiency is there. And nowadays, doctors must be telling you to consume vitamin D, vitamin A, zinc. All these are necessary to prevent infection and increase immunity. Let me go to one, because of the time, I will not spend much. So let me tell you about the zinc deficiency. So 1/5 of the preschool children are having zinc deficiency. But in a state like Odisha, it is 19%, and 42% of the adolescents have zinc deficiency. And zinc is necessary for immunity and reducing infection and reducing diarrhea. So there are many micronutrient deficiencies, very, very pervasive across all people, including children and also including adults. Another thing which you can see through red ink, red color, I put it like that. Children with pre-diabetic is also there. Around in India, it is 10.3% school-age children and 10.4% adolescents are pre-diabetic. In Odisha, almost 20% children are pre-diabetic. So you can see how India's vulnerability is going to increase. These children who are pre-diabetic also will be obese latter stage of their life. And you know that how in US and other European countries, because of the obesity, the pandemic infection and mortality is very high. So we need to be very serious about this during childhood and since from the childhood also. Next slide. Overall, and this is a very important slide. Why child nutrition is important? Because first 1,000 days of life is more important. First 1,000 days starts from pregnancy to 2 years of birth. You see how sensory, cognitive development happens. Better IQ for human capital, you need to invest that during this time. And if you miss this time, which is called first window of opportunity, you miss whole life of the child. Even you give anything and everything, better food, better anything during adult, during manhood or womanhood, but it will have very less bearing on human capital, cognitive development. There is one very old study, I don't want to refer, but for your reference, just I am sharing. India's average IQ is 82, and which is equivalent to Mozambique and Bangladesh. If average IQ becomes like this, then how can you think about skill India, digital India? How can you think about new India? So realizing this importance, Honorable Prime Minister launched Poshan Abhijan. Next slide. Poshan Abhijan, and Honorable Prime Minister realized how important it is. Next slide. And how important it is to invest on nutrition. Next slide. Poshan Abhijan, which came out in 2018, and it was shaped by the determination of Honorable Prime Minister himself. It is a target-driven, and where the target was to reduce stunting by 2% per annum, undernutrition by 2% per annum, low birth weight by 2% per annum, and anemia among women and children 3% per annum. Apart from that, there is also a target to bring down stunting of children 0 to 6 years from 38% to 25%. This is very important. Why Poshan Abhijan is not only important for India, but entirely important for the world, because India is home to 1/3 of the stunted children. India has highest number of wasted children. So if India's nutrition agenda is shaped, if India changes, addresses malnutrition, whole global malnutrition agenda and SDG 2 agenda also will have bearing. So very important step, very important milestone in the history of nutrition in the world. Next slide. So after launching of the Poshan Abhijan, it again with a lot of policy commitment, with a lot of political will, many things are happening in India. I think today I'm going to share what has happened after 2018 when the Poshan Abhijan was launched in March, and all these activities, and you can be a partner, or you can try to see how it can happen in your own area. There is a Jan Andolan, People's Movement. It is happening. Nutrition, before launching of the Poshan Abhijan, there was only 1 week was observed in September as Nutrition Week. But after launching, it is now 1 month. And this time, in last Nutrition Month in September, you name any minister, they talk about that. And specifically, you'll be happy to know that Honorable Home Minister also spoke about nutrition, almost all cabinet colleagues. Then there was a launching of the Anemia Mukt Bharat, which is another important step. Aspirational district, 30% weightage is given to health and nutrition, which is another important step in 117 districts. Eat Right India, Fit India movement, again, Honorable Prime Minister also launched this. This is also important. Fast nutrition survey came in India, and I shared you some data. Then there is a food atlas, new nutrition anthem was launched. Next slide. New policy on agriculture, nutrition is also being now being drafted. I have seen in NDMA people also attending that meeting, part of the steering group. Then Posharma I spoke. Then biofortified crop. Honorable Prime Minister in last October launched dedicated 17 biofortified varieties of 8 crops to the nation. This is also very important. And naturally biofortified crops are there. Even drumstick is a biofortified crops, but this thing which Honorable Prime Minister launched is for conventional hybridization. So zinc enrichment of rice, so millets, so Prime Minister launched. Then technology-driven prac for children, Honorable Prime Minister launched. Jal Jeevan Mission, which is very important. Nutrition is now mainstream. Separate nutrition budget. Many states have done wonders. Odisha is one example to include separate nutrition budget. This year only. Organic kitchen gardens. Many states, starting from North India to Southern India to Eastern India to Western India. Many states have linked Nutri Gardens, linking to Manrega and also millet promotion. Promotion of nutrition. Next slide. Promotion of nutrition cereals, specifically millet, is being promoted across the country by many states. Earlier, it was through civil. Next slide. Civil society group. Now it is through government support. Then what can be done? I think it is a time for nutritional self-sufficiency or Atmanirbhar Poshan. The curfews, lockdowns, and social distancing proved that we need to be self-sufficient. So it is necessary to address undernutrition. If we could strengthen our Food Security Act, undernutrition can be addressed in many ways. Addressing protein hunger. So if we expand our food programs and income safety net, diversifying both production and farming system to include poultry, fishery, dairy, then and smallholder farmer, then protein hunger can be also addressed. And during the welcome speech, you heard that our country is prone to multiple disasters. So very difficult to address protein hunger when such disasters happen. Micronutrient malnutrition, I talked about that. Nutri-garden is one. Dietary diversity can happen. Food fortification is one such measure to address micronutrient malnutrition. Food Safety Authority of India in 2018 brought out guidelines on fortification of 5 commodities: milk, rice, flour, and others, and edible oil. Biofortification I talk. Addressing obesity and overweight is very important. But next slide. But there are two things we need to keep on addressing malnutrition. One is investing on 1,000 days, starting from pregnancy to till 2 years of age. The second is investing on adults and girls because they are the future mothers. Today's topic is about child nutrition, but I want to bring before you an important data. In India, almost 91% children between 6 to 24 months do not get 4 food groups. When I presented this data to before a top policymaker, he told me that, do you think that people from upper class, rich people also are not able to feed them? I told yes. They must be feeding Cerelac, they must be feeding many breast milk substitutes, but not the 4 food groups. So these are the 10 groups I have mentioned. It is necessary that in every district they should work or work on climate smart, nutrition sensitive agriculture to grow all these things. At least children can get 4 food groups and pregnant mother can get 6 food groups. Unless we provide these, then the basic nutrition in 1,000 days will not be achieved. So climate smart, nutrition sensitive agriculture is key. Next slide. These are some of the interventions along with food related. Infant feeding, I spoke. Food and nutrition is necessary. Immunization is necessary. Institutional delivery is necessary. Water sanitation hygiene is necessary. Almost 23-24% people get safe water. I think with Jal Jeevan Mission things will change, but till such time we need to invest on that. Deworming medication is very important. ORS, zinc, fortification, dietary diversification, adolescent nutrition, convergence, early childhood education, maternal nutrition is also necessary. For child nutrition to happen, the pregnant woman needs full antenatal care. In India, it is less than 30% now. Full antenatal care includes tetanus toxoid injection, then blood pressure measurement, rest during pregnancy, 1 additional meal. In India, you must be knowing that low birth weight children are born around 18 to 20%. 1/3 of the low birth weight is attributed to maternal nutrition. So if you do not invest or do not take care of the pregnant mother, then definitely we cannot take care of the child nutrition. So we need to do that. Convergence, next slide. Convergence is very important because in the Anganwadi, there is a particular day called Village Health Nutrition Sanitation Day, when both Anganwadi worker and ANM come and they provide health and nutrition services. So that convergence is not happening in many places. And specifically during this pandemic, there is also disruption of convergence, disruption of nutrition service and supplies. We need to work. Government is doing commendable step in announcing a lot of policy measures, but we need to make it happen, and starting at the village level, at the district level, at the state and national level. Such convergence is necessary. So sometimes I say Gram Pradhan se Pradhan Mantri tak and Gram Sabha se Lok Sabha tak, we need convergence and mandate for nutrition. This is a slide I thought of sharing because around a lot of child deaths we used to hear reported, not necessarily all these are linked to malnutrition, but if you could be careful, definitely 100% child deaths due to malnutrition we can prevent. There will be some child which will be normal, so we need to try to protect them. Those child who come under mild and moderate, we should not allow them to that red line, severe. And in case some child goes to severely affected malnourished category, then we need to refer them to nutrition rehabilitation centers. So that let us place today, at least very important, no child death from tomorrow. Because today's children are the future of the country, future of the nations. So why should there be any child death? So survive and thrive is very important. And if you could address and severely affected malnourished children, definitely we can prevent deaths. Next slide. So nutrition rehabilitation centers which are available at sector level, at block level is important. This is about, India is a very, very important country. This is about our food law, which came out in 2013. It talks about food and nutrition security in a life cycle approach. It talks about food, it talks about nutrition, drinking water. So I have summarized the entire law in one slide. So you can see how powerful it is. It also talks about food security allowance instead of if there is no supply of food, and it monitors three food programs: India's ICDS, PDS, and midday meal. So every state has a state food commission. So if there are grievances, you should raise those issues to before the food commission. So next slide. So it is important that we should increase the good governance and better regulatory practices so that people get their entitlements. This is also Honorable Prime Minister's vision, making it a people's movement, John Anand. And people's movement is possible if we could leverage existing platforms and human capital. We have self-help groups. India has almost more than 5.5 million SHG with 60 million members. We have medical colleges. We have almost 250,000 gram panchayat. Village health, nutrition, sanitation committees, almost 5.5 lakh. We have dairy cooperatives. We have Anganwadi centers. And you will be happy to know that almost 13 lakh Anganwadi centers having almost 14 lakh Anganwadi worker, 14 lakh helpers. If you could organize, galvanize, and leverage all the human capital and also social capital, then definitely nutrition. Next slide. Nutrition can be a buzzword. Nutrition can be a very, very important thing in a country. So, so this is my last slide. You can see the data. This is also old data, National Family Health Survey 15-16 data. I am sure there must be a lot of changes. So if you could want to do something on child nutrition, we need to improve access. You need to improve governance. You need to improve their entitlements to nutrition supply and services. So they should get better sanitation. They should get vitamin A supplementation. Vitamin A supplementation, iron supplementation. Today it is almost 26.1%. Why it should not be 90%? Even antenatal care in India is 21%, but that was in 2015 and 16. But why should ANC not become 90%? So stop disruption, whatever may be, should be our motto. And let us place today for no child death. Let us place today to invest on child nutrition. Let us place today to make nutrition as a household name. Let us place today to make nutrition as a buzzword and our policy and commitment. Because if we invest on nutrition, definitely we can invest human capital, invest and increase IQ, growth, increase growth, demographic dividend, and make our country a prosperous country. Thank you so much.
Thank you, sir. Thank you. Thank you, sir. Thank you very much for your wonderful and highly captivating and fascinating and above all, a thought-provoking lecture. So I request you to stay with us for a question answer session. I was observing the chat box, but there is no question till now from the end of the participant. But again, we have one more lecture by Sri Roy Kancharla, sir. So we like to go to him to listen to his lecture and see his presentation, and after that we'll go for a question answer session, and we'll be happy to have the question from the end of the participant. And before I request before I request Sri Roy Kancharla sir to go ahead with his presentation and valuable lecture, I would like to take the opportunity to introduce him to the audience and our distinguished delegates who are present here today with us. So Sri Roy Kancharla sir has almost spent 30 years in development, humanitarian and media profiling and resource mobilization, and 15 years in mountaining 15 years in mountaining 40 humanitarian responses, out of which 21 years have been child-centered integrated humanitarian responses and risk reduction across children, communities, schools, and governance. He has got knowledge and practice in delivering triple nexus agenda. The key streams of his competencies are many, such as he's a strategic planner, he's a trainer and visiting professor, he's a concept creator and designer. He has presented and represented a numerous presentation in national and international forums. He is also an expert in integral human development, planning, program management, and capacity enhancement. He has commissioned and accompanied and contributed to and led many evaluations and learning publications. So now I request our respected speaker, Sri Roy Kancharla sir, to please deliver your valuable lecture and enlighten us with your thoughts. Thank you. Over to you, sir.
Thank you, Dr. Ratan Sarkarji. And to all the dignitaries from NIDM, I think Professor Santosh is still there. I don't know if Major General Bindal is there, but still want to thank all the NIDM officials and also the co-partner of this event, Mr. Amit ji and Mr. Ratan, and especially all the participants. Very good afternoon to you all, and thank you for this opportunity to be able to share this knowledge and experience with you. The subject that we are talking of is child-centered resilience and adaptation. So when we talk of child-centered resilience and adaptation, we need to look at, this is like a master slide that looks at, the rural, urban, and then keywords here are displacement, deteriorating natural resources, conflict, refugees, many others. In fact, Professor Santoshji said about migrants. And we have witnessed a scenario called reverse migration that has happened. And in this, all of us need to be together. The one line, if we want to see our children and youth resilient, is to believe that we are all in this together. This should be our anthem, that we are all in this together. You may be from academia side, you may be a duty bearer, you may be practitioner, whatever you are, a household person, but we are all in this together. So primarily in disasters, of course, you see in the corner, saving and protecting lives. This is what we do. But beyond that, we want to ensure that in this country, every child that is born is resilient and climate smart. This is something a while ago, Mr. Basanji also said that we need to ensure that no lives are lost and climate smartness is very important. And all the sustainable development goals are linked to this agenda. Now, it's important to decide what is that resilience that we want. I'm sure many of you have your own definitions or have read these, but from the children and youth angle, this is what I wanted to present to you, that it's an ability of a child, household, community, institutions, and government. See, there are at least 5 such nodal, spaces where this should be talked about. And the whole idea of resilience is that you must be able to anticipate, prepare for it, manage it, recover and improve from the recurring and protracted shocks. So which includes both natural and human induced crisis. Both are important. So this is a definition, but I want you to note down, if possible, in the chat box, some of the keywords that come to your mind when you hear this word. You have heard about malnutrition, you have heard about all the risks. Now you're hearing about children, youth in a very wider way. We are talking of disasters, we are talking of climate change. So what are those keywords that come to your mind? You can type them in your chat box if you have access to. And then I want to definitely pick up some of your words on, numbers and points that come to your mind. Anyone typing some words? Let me see. I want to see your participation. No one still? Okay. I'm not seeing any words. So it would be important to mark your keywords on, chat box. What are those words that come to your mind? Now, how do we approach this whole resilience? Now, when we define the problem, definitely the key word that already Mr. Basanji has used is vulnerability. We are talking of disasters and climate risks, both. And then our natural resources are deteriorating. We can see the water quality is changing. The sea level rise is happening. Warming is increasing. Every summer we can see it is getting extended. So now in this approach, we are talking of something which is very child-centered, and that is where we are talking of a very circular model which touches all the lifeline areas of a child's life and eventually even in adulthood. So we're talking of health, nutrition, water, sanitation, hygiene, education, etc., and then livelihood, social protection, as well as child protection. So all these are important for us. And when we talk of resilient community, we are talking in rural and urban areas. Schools are a very important nodal institution for this. And then technology also becomes a very important factor for us. So now we are talking of rural urban vulnerabilities. So the word resilience looks at that. And we are also looking at where a child spends the best part of his or her life. And that is the school. And we know from our experiences the risks that schools have, right? From home to school and back home. Professor Santoshji is one of those who introduced this pioneering concept called homeschool home approach when he was in the NIDM as the director. So these are some of the things that we need to look at. And technology becomes a very important area, but the outcome of all this is definitely family or household level resilience planning. If family resilience is understood, there will not be malnutrition, there will not be disease burden, there will not be other vulnerabilities that we struggle with these days. Now, how do we approach this? It has to be inclusive. So there is a triangle here. We are talking of children, we are talking of youth, we are talking of school, we are talking of technology, we are talking of the family, and then the institutions that are linked to this. So there is a very triangular relationship, and triangle is the strongest of the shapes that we could look at when we talk of resilience. Now, this is actually the mantra that we say in non-emergency time when everything is right is okay, we don't worry too much. But when a crisis strikes, that is when we begin to be worried. And then we say we are unable to protect the progress or the gains we have made by the development work that we are doing. So how do we work on that? How do we protect the gains, the progress that we have made? Then we are talking of a window of opportunity to improve access, include the excluded with quality. So disasters are seen, though they are not welcome, but we transform them as newer opportunities. And then we are talking of a safe place, which is physical and psychosocial protection is very important. And then we are talking of building a platform for life-saving and life-sustaining interventions. That is why we say health model encompasses all of them. With these, you will be able to save lives. So the outcomes definitely are that we will have life-sustaining services and we also will have risk reduction services. Both are important for us. And these are some of the areas that we need to look at the household and community level, that there is a contingency there is early warning, and we have saved some money which is flexible for that. And of course, Government of India is highly committed with 10-point agenda of the Honorable Prime Minister, and institutions like NIDM, NDMA, state disaster management authorities, horde of civil society organizations are working in this. But the more we do, there seems to be more to do. So this is where how do we work for additional progress and additional gains. Now, we have talked of nutrition a lot, but just one quick look at the childhood illnesses, which are all preventable. But then there is a disease burden and death that happens. For example, pneumonia plus other childhood illnesses kill so many lakhs of children, okay? The diarrhea, tuberculosis, pneumonia, and then malnutrition itself, though it is not always acknowledged, we know that every 20 to 30 seconds, a child under 5 dies, and half of them before their 30th day after birth, etc. So how do we ensure that a child survives, learns, and is protected? So there are some benchmarks already Shri Basanji has given, but these are some of the things that we could look at. But the two large priorities are maternal health and newborn health. These are very important factors, especially for us as a nation. The second area that we talked is about comprehensive school safety. Now, lakhs of schools, and whenever a disaster strikes, be it earthquake, be it floods, cyclones, schools become a very important location to look at. If the school is standing, it becomes a relief center or a shelter for the affected communities, or if it is collapsed, then schools get closed. In either case, the schools get closed. So how do we transform this reality into something different? So we have a global framework. India is already adapting this, government level and school NGO level as well. So how do we ensure that schools are climate smart and there is a plan in place? So there are three things that we look at in this. One is the safe learning facilities, school disaster risk reduction and climate smart planning, and then risk and resilience to be brought into education. I remember Andhra Pradesh government way back in 2016-17 requested us to help in working on this. So we developed a vision with the SCERT, State Commission for Education Research and Training, where we said that your education sector must ensure that no child to be born in the state will die due to preventable causes. That means it should never happen. So this is something that we need to look at. Now, a small example of a boy who was part of a school, a disabled boy in Kendrapada district. He was part of an intervention that was done for about 3 years. He was very active. So one day he went to the Sarpanch and took his hand and asked him, come with me. I want to show you a place. So the Sarpanch went with him and he looked at the place, and the child took him to the school where there is a pond with water and all that. So he straight away asked, how many more children should die in this pond? So the Sarpanch was stunned. He asked, what are you telling, child? So he said, in 1985, so many children, because they didn't know when the water came, they didn't know the way and the pond, so they fell and died. And then 95, 98, 2004, etc., etc. So the Sarpanch said that you seem to have a lot of information, child. So come to our place and then in the Gram Sabha speak to us. So he led the whole children group there. and they presented the whole case. And that year, all the money which came to the village was spent to close that pond and make that a safe school. So this is a very localized exercise of listening to children's voice and making things better for them so that no child will die. And once that is a child-friendly school, there is surely no death possibility there. So these are local actions that will guarantee how we can actually change the risk map into a resilient map for the village and the community and children. We also promote this concept called children and youth champions. Now here you can see some children in Delhi, they became netizens. So once they understood the risk and so on, they started plotting risk through net, and they were getting ready to meet the city authority to explain that in their slum area, there is big risk and the city has to do something about it. So children's voice at city level is also something that we need to promote much more. The urban agenda is a very important area for resilience and risk reduction work, where health, nutrition, risk reduction initiatives are very, very critical. You can see that not only India, but the whole world is getting urbanized much more. But the poverty is also in the urban areas in a big way. So at least till 2030, all the frameworks are speaking that we should do something. So how do we work for this? So these numbers, of course, could be very difficult to digest, but then in the interest of time, I'm skipping these numbers, but we can share this presentation later. Now, these are all the frameworks that work for urban agenda. Now, from 2015, there are so many frameworks, but all of them are converging into, say, urban resilience is also very, very important. And so SDG number 11 is about resilient urban communities. So these are some of the frameworks that we need to still work for. And then climate change, fragility of the world system. In fact, this is a book that if you can read it, that will be very important. It's like a big encyclopedia called Planetary Health. So climate change and health are very important, upcoming issues, and they are our tipping points today and tomorrow. So we need to address them. So these are, again, global warming, which is continuing. Intergovernmental panel on climate change has already warned us. If you pass this 1.5 degrees, the human body tolerance will not be there. So we need to understand this much more vigorously. Climate change, youth and children, that's an important area that personally I am working, and I have been working for the last few years. And this, again, as Mr. Basant said, this is our tomorrow, and it's already today. Now, these are some of the consequences of the growing, changes that we are seeing on a day-to-day basis. And all disasters are now getting linked to climate change work. So we need to recognize this and work harder. If we address climate change, if we don't address, then all the development work we are doing will get compromised. And then the progress we make will be stalled, and more people will become raised. There will be more refugees, more migrants happening, and then more uncertain future. So we need to work very, very, very strongly. But if we do work, yes, we do need to do good needs assessment, always using a climate and disaster lens. Then our own design of action from inception, implementation, monitoring, assessment, all these require climate change adaptation lenses. The big picture is, of course, we have Sendai framework, we have SDGs, we have Paris Agreement on climate, we have new urban agenda, we have all these things that are there. But how are we converging all of them? So just want to lead you to the last point, that sustainable development goals, resilience, health, nutrition, these are intrinsically intertwined. So we need to work. So how do we localize all these into our context? In the small communities, rural and urban settlements, as well as in schools and health centers, etc. The whole framework is, of course, we should be able to anticipate it. We should be able to absorb the shocks. We should become adaptive and transformative. This is the framework that we need to understand. It's very complex. Probably academicians will find a lot more sense, but practitioners also need to work with similar framework. The shocks that we hear, when we work, we are looking at our own development action as well as other actions that we do. We have three lenses to use. Are we thinking of risk when we do planning? Are we risk informed? Are we risk sensitive? And last level is, are we risk transformative? So whatever action we do, we should apply the risk lens to everything we do. And these are some of the questions, and you could have a marker for yourself, how you score yourself. That if you in assessment did not talk of risk in the area where you are doing development, and that's where disasters come, then you become risk blind. If you are informed about the risk, but you don't do anything about it, you score yourself 1, but you're only risk informed, but you're not sensitive. But if you plan your work and you're very risk sensitive and you have some actions around it, fine, you can score yourself 2 in all you plan and do. But the last one is much more important, that while being risk sensitive at assessment level, information and planning level, programming level, and actual delivery and monitoring and documentation, then is a full circle, and that's where you score yourself 3. So this scorecard could help you to measure your actions, be it in development, education, and other areas. So what is in it for children and youth? This is what Sendai framework has strongly and very emphatically said, that we see children and youth as agents of change, and they should be given the space and modalities to contribute to disaster risk reduction and climate smart approaches in accordance with the legislation. So that means legislation should make sure that they have a place. So we are talking of children in parliament, children's parliament. All these are very important concepts to look at. The way we practice, and also curriculum must adopt all this fully, so that children from tender age will get it. In fact, currently we are doing something called Eco Anganwadi. Eco Anganwadi kindergarten is something that we are piloting now in some locations. So these are some small examples which can be replicated by governments and other institutions. Now, this is not the end, my friends. Let us see if we can make a new beginning. And I want to stop here and take questions and, discussion. Thank you.
Thank you thank you very much, sir. Now,
Ranjan,
जी sir.
I have a question to Mr. Ray.
Yes, sir.
I appreciate, I listened, and it was very, very informative and educative presentations by Basanta Saab also, and all the panelists, including Ray. I wanted to have your view. Can you elaborate, Ray, in terms of if we wish to set up the children parliament or kind of a thing in the, on the model of Anganwadi, which you are saying, that reform, how this can be brought in as an into action? Like, let us work, all the partners are here, and long experience of Mr. Basanta will also help in setting up that how, and you are an international, actually you are also going and bringing those your and Mr. Basanta's experience with UNICEF and all, we can set up why we are waiting for. So what would be the structure, what would the terms of reference of the parliament, how it work, and how it will help the or child-centric DRR, how it is going to help them, and how they are going to influence many of the things which we are related to them, and their voice could be heard. So they would be into a kind of a very interesting role. The children is what we want. So if they can cast their vote in the age of 18, they can decide 16 at the age of 16, definitely, that what would be the future of DRR for the country, especially. So we might be having our fossilized ideas that the more we grow, our experience gets fossilized in terms of time and other things. But the new breed, those who are coming as a future generation, they have to carry the load of the future generation as well as also the load of the coming generation. So I would be grateful if you can give a kind of a blueprint that let us work together and move with the time target. That yes, how we can move ahead with this as a real outcome of all the panelists' suggestion, that how this get converted into a kind of action. And other questions, maybe the distinguished delegates are there who are attending, they can endorse my point and they can impress upon Mr. Ray that how we can move ahead and also Mr. Basanta. So to carry this forward. But he has also seen many experiences that he narrated in his presentation. So how those gets integrated? Because this should not remain as a kind of a one place or 5 place or 100 places. India is very big. And India has to play not only this role of that what we are doing in India, but we also demonstrate to South Asia and other kind of Asia Pacific too. So how this we can take up? So my submission was humble submission to the panel.
Thank you, Santoshji. And in fact, you are very humble, I would say, because you are one of the pathfinders in this domain. You remember for SARC framework, how we worked jointly with you. So we have done, but probably, sir, what we could look at as an initial thought, brainstorming again, is how do we create a children and youth movement in the country so that their voice is led up to the level of our governance and parliament. And as you rightly said, we must probably create a children and youth voting pattern as well. So this is something that which is a very futuristic agenda. And as Shri Basant sir also said, we have to mitigate main things. Like as you said, we are already eating up what we should be eating after 5 years of the planet. Yeah. We should be eating this in 2025, but in 2020, we are already finishing the resources. So some of these we need to undo and recover that. So that is where I think children and youth would play a role with us. Yeah.
Very important. So what I'm saying that let us have a blueprint.
Yes.
That's what my concern is to develop. And we say that 2020, sure. we by the grace of God, everybody should be safe and sure. Healthy in this period. It's a very tough time for everyone.
Correct.
If we process well, and then we can have a kind of a launch in the 2021, the first quarter.
Absolutely.
The first quarter of 2021, we should have this on the ground.
Sure, sir. Thank you. Dr. Basant, sir, do you want to add anything? Basantji?
Yeah, just only one point. I think very, very important suggestion. Thank you so much. I had some experience of working on children's parliament in Bangladesh, so I'll be happy to contribute. Just I shared my article on nutrition parliament. So the link I shared at your convenience, you can think. So nutrition parliament, combining your idea about child parliament and Anganwadi center will be, I think, exemplar model which India can show to the world. And I'll be happy to contribute. Thank you so much.
Great, sir. Yeah. So we would like to sit with you, Professor Santosh, maybe in January, to come together and develop a roadmap, and probably through another event like this, we can share with our colleagues across the country how to make this into a movement. Yeah.
We said that as an older person, we may slog and we move slowly, but the children's center should run fast. But they are the energy. They are the energy guys.
Exactly. Yeah. So let's work for that, sir. We'll work with you on that. Yeah.
So today's a wonderful outcome, which I'm saying that we are going to set up in the first quarter of that Chinese parliament in the country.
Sure.
With a collaborative effort, not one kind of a collaborative.
Thank you. Ranjanji, over to you. It's 4:30. Yeah.
Sir, one question in chat box. What action should be taken at a state and district level in India? How can we collaborate with SDMS and DDMS?
Okay. I mean, I thought Professor Santosh should answer that question, but I can also give my viewpoints. See, already we have a South Asia level framework. There are 10 points, and we do have our Prime Minister agenda of 10 points. Basically, we need to adopt it to the children level, and at every state we should create similar, like NIDM has a child-centered DRR unit. So every state also could consider collaboratively set up under the coordination of NIDM such small units and position visibly the focus for children and youth. Right now, there is no visible desk or a person in every state unit. So I think this could be one recommendation we can make for every state.
Sir, Sendai framework have a top to, local to top level approach, na? So
Exactly.
all activity start from local level.
Absolutely, absolutely. Fully agree with you on that. Fully agree. Yeah.
Only NIDM and NDMA policy framework, develop policy framework, but the implementation part from the local level. So
Absolutely.
any activity at national level or local level, joint collaboration with integration with climate change or child-centric DRR, all activity in focus with local to top level approach.
Absolutely, absolutely. And I've seen lots of messages in the chat box. Many participants have said that we need to link this right from lower level education to the highest level of academia. And I think already NIDM has initiated a inter-university movement also. I happen to be part of one of those, and Professor Santosh was actually moderating, I thought, that one. So we need to connect and converge these areas. Professor Santosh, would you like to add a line on that?
Just you said that it's very good, that convergence. We wanted seamless integration, and NIDM is going to do a curtain raiser for that. We have already done, the secretariat has been formed, and many members have already become the members of that IUN, Indian University Network for DRR. And maybe in the month of December, by say during the time of Christmas, or maybe soon after the Christmas, we will launch it. So that child-centric DRR and also that university networks get together and that get a seamless integration with each other. That would help each other.
So now I request to reconsider sir to give some key point, key takeaway regarding to
Professor Santosh has already given. Professor Santosh has already given the key takeaway for us, and that is what we will all abide with. That we will have a roadmap developed soon around the thematic areas that we have been talking. Second is definitely that we would work together on each of the thematic areas like health, nutrition, water, sanitation, hygiene, and then overall agenda of enabling participation of children and youth to protect our future. So these are some of the top lines, and as Basantji said, and I fully endorse that view, that no child should be lost to the world.
Sir, without
no child should die. That is our pledge. That is our pledge. So, and we should do everything to prevent it, because all these things are preventable. Okay, all the risks are preventable because they are all human induced. Nothing is God made, nothing is natural. We have interfered with the nature. So I think that has come out very strongly. And focus on the minor 1000-day window is a great offering. And so these are some of the top lines which will go into the roadmap. And also we will link as a convergence practitioners and academia, research institutions and policy institutions. That is also coming out very strongly, especially from the reflection that Professor Santosh ji made. So thank you for that. Thank you.
Thank you, sir. Thank you, sir. Now I request to Ratan sir for vote of thanks.
Okay, so hello, am I audible? Hello.
Yes, yes, we can hear.
Okay. So first of all, thank you to the entire team of NIDM for taking effort to organize such a wonderful program, especially to the Major General Manoj Kumar Bindal sir. Then my heartfelt thanks to our admin, respected Dr. Amit Kumar Desai, Honorable Principal, Pavatkom College, Kontai, for cooperating us, for joining us. And then, of course, my thanks and sincere gratitude goes to Professor Santosh Kumar sir for joining us and enlightening us with his kind and valuable words. And then my sincere thanks also goes to our most respected and distinguished speaker of the day, Sri Roy Kancharla sir and Sri Basant Kumar sir ji. Then my thanks also goes to my co-coordinator, Mr. Ranjan Kumar sir. He has taken all the effort to make this event successful. And definitely my thanks goes to Dr. Balu sir for taking all the effort and helping us to complete this program with success. And then my thanks goes to all the participants who have joined us from different parts of the country and actively participated in the program. And I can see their feedbacks and the kind of questions they are writing down in the chat box. It's just like overwhelming. So one more session, a session like this, which just took place for 1.5 hours is not enough, I think so. But I really appreciate your energy and your motivation and your active participation in the program. And this I just conclude. And thank you very much, sir. And if I have mistaken to convey my sincere thanks to anybody who directly and indirectly help us to complete this program, then this is my mistake. With this, I just conclude. Thank you very much, sir. Thank you very much.
Thank you. Thank you. Thank you, sir. Thank you.
Thank you everyone, and thank you all the participants for having the patience to listen and giving your feedback.
On behalf of NIDM, once again, I thank you to all participants for joining today webinar. हाँ, सर्टिफिकेट सभी पार्टिसिपेंट को दिया जाएगा। अभी हम लोग प्रोसेस में है, टिल हम लोग अगस्त सितंबर तक कंप्लीट हो चुका है, लोगों को मैंने ऑलरेडी भेज चुका है, तो इन प्रोसेस में सर। तो पेशेंस, हम पार्टिसिपेंट से रिक्वेस्ट करते हैं कि पेशेंस रखें, सभी को जाएगा सर्टिफिकेट, इसमें कोई दिक्कत नहीं होगी और हम लोग प्रोसेस में हैं। थैंक यू सर।